Well, welcome everyone to Dementia Chats. I'm Lori LeBay, the founder of Alzheimer's Speaks, and this is just a privilege and an honor to be part of this conversation. Today you will hear from people living with the diagnosis. That's what this platform is all about, raising their voice and their insights. And today we've chosen a topic of, do they really know? How do you treat somebody once they're diagnosed? You know, does it change? And how do we communicate with a person with dementia? And what does a person with dementia think about that approach and style? And so that's our topic. And I think it's going to be very, very interesting. But before we go there, I'm going to go around and have everybody introduce themselves. And I'm going to go to Elon first because he's my co-facilitator, and then I will go to all of our experts. Elon?
Hi, everyone. My name is Elon Caspi. Both of my grandmothers had dementia in the final years of their lives, and I'm a gerontologist and dementia behavioral specialist with Dementia Behavioral Consulting here in Minneapolis. I'm here to learn from the lived experience of you, the experts, who actually know what it means to live with dementia, and to share some of the things I learned along the way in my 23 years in the aging field. So I'm very thrilled. I'm always looking forward for these sessions. So I'm looking forward for another good one today.
Great, thank you. Michael, do you want to go next?
My name is Michael Ellenbogen. I was diagnosed with Alzheimer's at age 49. I am now an international dementia advocate and spend all my time trying to support the cause.
Great, thank you. Bob?
My name is Bob Savage. I was diagnosed with Alzheimer's about 2 years ago. And fortunately, things are moving along slower.
Okay. Harry, can you introduce yourself, please?
My name's Harry Urban. I live in Pennsylvania. I was diagnosed 13 years ago with dementia of the Alzheimer's type. I became a advocate for living beyond your diagnosis. I became a Purple Angel ambassador and a Sentimenta ambassador.
Thank you. Mary?
My name is Mary Radnofsky. I have subcortical leukoencephalopathy, which is probably something of a genetic origin because my mother also had the same type of dementia. I was first misdiagnosed 12 years ago, then re-diagnosed a few times, like a lot of people. And I'm also an advocate for the human rights of people with dementia.
Great, thank you. And our other Mary.
Hi, I'm Mary Reed from Lidditz. I was diagnosed when I was age 50 with Alzheimer's. Since then, I've also been diagnosed with vascular dementia, and I'm an advocate for Alzheimer's.
Great. Well, again, thank you all for joining us. I think this will be a really interesting conversation. Typically how we pick these topics is we just get together about a half an hour before we start, and we start chit-chatting on what do we think is important to discuss. And, you know, this idea of how do you communicate with somebody with dementia, I think is really critical. There's a lot of people giving advice, and one of the things that came up in our kind of pre-discussion was there's a lot of care partners out there that all of a sudden feel like they're experts in the field, and some of those opinions and insights are felt to be valid, and others not so much. And then we talked about just talking with neighbors and coworkers and friends and family in terms of how they approach somebody once diagnosed. So I'm going to throw it to Bob first, and it just asks for some of your insights in terms of how you feel people approach you now that you're diagnosed.
Well, one of the things I experienced that as soon as I was diagnosed, people started to treat me differently. They would start to speak to me more slowly. And they, even when they spoke to me, they wasn't positive that I understood. But I also found that not only my caregiver, but other people could, and I've lost the word for it's not dementia, but the stigma. The stigma related to Alzheimer's and dementia is so strong among all the population that as soon as they found out an individual has Alzheimer's or other forms of dementia, they think of the person as already should be in the nursing home. They go right to the advanced stage rather than all this wonderful time that you have between the diagnosis and when you're there. And there's also this emotional connection that when a person, you notice that immediately, I noticed it immediately, was when a person talks to me now, it's not only the words that they're talking, it's the emotional connection that they have with me, that they really understand the situation I'm in, they have compassion. If they don't have that, they could have the most appropriate, caring words in the world, and it's not going to have an impact on me. So there's a real combination there of both the words and the emotional connection and understanding of who I am and what I am at this point.
Okay, well, that's a really good insight. So I appreciate you adding that. Michael, what are your thoughts on this topic?
Well, I got to tell you, when I first learned I had this disease, the one thing I did is I became very educated in this, and I started attending all kind of courses and everything, and I quickly realized there weren't many books and things like that out there on this topic. But I'd say in the last 4 to 5 years, I'm starting to see people just come out of the woodwork with all kind of books and experts who claim to, I guess, kind of be the people who know it all about dementia. And for me, I find it frustrating because these are people who are trying to teach and educate other people out there who have to deal with people like me. And I find it, I guess, to a point that it's very frustrating because I hear what they say and what they're teaching, and it's my belief that what they are teaching is very incorrect. They really don't know what they're talking about, and they're basing their experience on one individual. And not only are they basing things on one individual, they probably really didn't even have the conversation with the one individual that they've formulated their ideas that they're writing about. And what I mean by that is, you've been doing this for many years, Lori, and you not only have talked about this, but you've educated yourself by dealing with people with this disease. And not only have you done that, but you ask questions, and then you ask for clarification on things. Well, that's how people can really learn about this disease. And then you can really speak about it. But you get people who were caregivers, and they watched their loved ones go through this disease, and they observed how they performed and all. And based on that, they formulated their own thoughts on what that really meant. And I got to tell you, I've had conversation with some of these people who have written these books and all. And I talk to them and I say, well, why do you think this has happened? And they say, because of this. I said, well, I don't think that's the case. I said, this is why I do it. And they go, oh, I didn't know that. Now that makes sense. And it's like, these are the people who are trying to educate all these other caregivers who, sadly, the caregivers who are out there, they want the knowledge, but they're getting bad knowledge. And that just frustrates the hell out of me because, you know, we want people to become educated, but they're becoming educated with the wrong information. And that's sad. That's really sad because I don't know how we're going to stop that. And there are so many people coming out today, and I see all these, what's the word? Conferences online of people trying to educate people about this disease, and they are clueless, completely clueless. And it's sad because we're teaching a bunch of people the wrong way to take care of people with this disease.
Well, I think you made some good points. I think one, a lot of people jump in, and Mary had mentioned earlier when we were offline about that it can be a healing process for the care partner. share their knowledge or, and process things. And I can say for me, on my journey with my mom, this work has been really healing. But I also know that my mom was one person out of millions, and every person has a different situation. Every care partner is coming from a different situation, so that needs to be taken into play. I think others are out there wanting to make money. They see this as a big target market right now, and people think if they even write a book, they're going to get rich. And most people, let me tell you, aren't going to get rich writing a book. It's just not the way it works. But I think what hit me the most, Michael, about what you were talking about was that people are giving opinions, and opinions are good. I mean, they're conversation starters. But I think there's this belief of the silver bullet, that there's one way or the highway, and people pitch it in that fashion. And I can say that's one thing I've tried really hard not to do, to try to teach people that it's a toolbox, and this is truly a trial and error. And just because it worked even for you doesn't mean it's going to work again. And then I think the most important thing that I heard you say was that a lot of this stuff is being written and being disseminated without asking or including people with dementia on what their thoughts are about it. And I have been surprised, and I learn from these sessions every single time we do one, because of what I hear. But I think in order to open that door, we have to stop thinking that there's a right or a wrong way. And especially here in the States, I think we have that mentality of one way or the highway, and it's right or wrong. And we're scared of failures. We don't like to talk about those things. We don't want to embarrass anybody. But I think if we approach dementia on a conversational that I want to learn. I want to learn. Educate me on real life learning. And if we ask our questions sincerely, that opens the door for people to really feel comfortable to tell us what does work for them and what doesn't, versus a lot of times I think there's more accusations or assumptions, and then walls go up, and then the conversation kind of dies, or an argument ensues. And so I think you made some really good points, and I appreciate you sharing those. Anybody else want to add to Michael or Bob's comments? Mary, you've got your hand up.
Yeah, the point about it's important to hear all of these different perspectives, I think is worth emphasizing, because even though there may be people out there who are speaking as though they are experts, in fact, they are experts with their loved one to some degree. Now, the need to be able to share that is great, and there's a lot of great organizations out there where caregivers can go to find each other and be compassionate with each other and complain with each other, as everybody needs to do, right? But the real point in being able to help someone with dementia is to listen, is to focus in on what it is that this person particularly needs. Since it's a disease, it's caused by a multiple number of diseases that affect different parts of the brain. Care partners need to understand that just because someone else, they have a friend that also has dementia and their care partner has told them what's worked with them, does not necessarily mean it's going to work with their loved one as well. So it's a matter of actually communicating with the person with dementia, and that's finding out strengths and weaknesses, preferences, communication styles, personal needs, personal desires, freedoms, choices, decisions, and getting the support that we need in the kinds of decisions that we want to be making. Some people need help just choosing what to wear or eat every day. Some people simply want to be made as independent as possible. Just teach me how to use the alarm on my house so I can feel I can come and go safely. I'm fine with cooking and eating and all of that other stuff. So it depends, and it's very important to find the minimum amount of support that someone needs in order to feel comfortable and autonomous, and not to overstep that support.
Yeah.
Good points. I'm going to go to Harry and then to Elon.
Well, I want to just take a step back and say, first of all, I love what Mary just said, but I want to just ask Michael if he can share the story that he shared with us a few years ago, and I can remind you some of the details if it's hard for some reason. When you were shortly after you were diagnosed, or sometimes after you were diagnosed, Michael, you drove to a gas station and you ran into a friend. And then what happened? Do you remember? Or, well, you were starting to chat with him. You were so happy to see him, and he was happy to see you. And then you shared with him that you have dementia. And what did he? Does this prompt any?
I remember talking to somebody somewhere, but I don't remember the issues at this point in time.
Well, you told us that he said something very nasty, probably from lack of education about what it means to live with dementia. What is dementia? He basically said, "What are you doing on the road? Why are you putting other people at risk?" When you were so at the early stage, and it was very hurtful.
Yeah, I remember.
I thought that because Lori also asked about how did people react to you early on, years ago, right? But I just wanted to remind that. That's all.
Well, I'll tell you, you bring up that I just had a thing with my wife the other day, and this is what I mean. We all think we're experts. My wife, she's a very intelligent person. She does heart surgery, and she's an RN. And just the other day, we had this thing where she was trying to tell me how to do something on the computer to download some pictures, and she wanted me to do it her way. And I got so damn frustrated at her, and I said, I wish you would damn understand already that you got to do it my way, because I can't remember to do it your way. And this is what I mean. These caregivers think that they know everything, and then they write these books because of how they think it should be done. Well, she never talks to me about these things, and that's what I think most caregivers do. They envision on what they think is right for the person with this disease, and it's not until people like me blow up and say, hey, enough is enough already, this is how it's got to be done. So there's no dialogue, and yet they write about these experiences, and the experiences that they think are right are really wrong. Because I will tell you, there's very little dialogue in my house. It's what she thinks is right, and I don't discuss it with her because I don't want to burden her with a lot of things, but there's times that it comes out that it's, hey, I've had it. You got to do it my way, otherwise I can't do it. And that's what I think is missing with the majority of these people who write books. They don't have the dialogue, and that is key. I mean, if you don't do what Lori does, it's useless. It's useless.
Right.
Bob, I'm gonna go to Harry first, because if Harry still has his thoughts, and then up to Bob.
Yeah, it's amazing, right? Because it's been my experience that the people that think they're the best communicators are the best interviewers. Okay. Most people that talk to me are not talking to me, they're interviewing me. They're asking me a series of questions. Now, if you would ask them, do you know how to communicate me non-verbally? They give me that dumb look. And it's amazing that we live in this disease. We have a hard time comprehending what you're saying. I have a hard time processing what somebody says. So when somebody's talking to me, they're not talking to me, they're interviewing me. They're rapid firing me with questions. and I had no idea what to say. But I am able to go into any, I don't care what care facility it is, I am able to go into them and communicate with any resident that is there. I communicated with many people in the late stages without saying a word. Your eyes, you don't have to speak. Your eyes speak for you. Your touch, you know, if you touch somebody's hand, they know, I love you. You know, you don't have to say the words, you know, things like that. People don't know how to communicate with us. You know, they think they do, but they don't, because they try to interview us. And it irritates me so much, because the best communicators are the ones that stay silent. They listen. Okay, they don't try to force us with their ideas. Mm-hmm. They don't have to. If somebody's looking into my eyes, I can tell if they're honest or not. I can tell if they're sincere or not. You know, I think communication is based on a feeling. If you don't feel that bond, you will never, ever communicate with me, because I will turn you off. I will see you as a fake, and I will turn you off.
Right.
Mm-hmm.
Well, and I think you make a good point about the interviews. Even, you know, what I do on the radio show, and people always ask me, like, you know, what questions are you going to ask me? And I say, I want you to tell me what you're passionate about. What do you think is important? I mean, to me, that's how we raise consciousness of what's going on, instead of me assuming that these are the meaty topics or what needs to be talked about. I want to hear, you know, what others have to say, because I think a passionate conversation is always much more interesting, and that way you're always learning. You know, you're always learning, and I just think that that's so important. I also liked what you talked about, the nonverbals, and I think that the nonverbal aspect of communication, I mean, I worry about the kids. What are they going to do? Just send emojis? You know, I mean, they're texting away. I mean, we think it's bad now. They're really going to have trouble, because they don't even answer the phone half the time. You know, they just text or Snapchat or whatever. But I think that the nonverbals, it's important for us to read somebody else's nonverbals, but it's also important for us to read our own nonverbals. And I think people really don't. We always look outward, because it's always easier to blame somebody else or assess somebody else, but it's always harder to look inward. And what are our nonverbals saying? Because a lot of times our nonverbals are the trigger points for somebody else, because we're always reacting. You know, that's just human nature. Everybody always reacts to everyone else. And so if we can understand what our nonverbals are doing to those around us, if they've got dementia or not, I think that that's a very important factor. Bob, you wanted to throw some comments in?
I'd like to follow up a bit on what Harry was talking about. I have this belief that in order to be able to communicate effectively with people with dementia, you almost have to be stigmatized yourself. It's very, very difficult for a person to comprehend our feelings. Right? Now, I see people here at the Alzheimer's Resource Center. There were some young women here who know how to do this. And there's one particular person that just likes to walk. And he's going somewhere, but he'll never get anywhere. He just goes. If I went up to him or someone went up to him and said, "Where are you going? You shouldn't be doing this," he'd get very angry. I watched this young person go up, put her hand on his shoulder, and approach him very gently, and might even kiss him on the cheek. He's milquetoast at that point. He said, "I know exactly what you're going to say. I'll do anything you want. Just lead the way." So that connection sounds simple, but unless you have the emotional, you can't fake it. Mm-hmm. unless you have the emotional connection to do that, it'll backfire. The other thing I wanted to say, is I did a lot of research about communication, and I went online. I spent hours, and most of the word that comes out, most of the information comes out is you should approach the person quietly. You should speak. It's all about words and how you should approach it. It has nothing to do about how you should do it. And so if you come with just the words and say, I got to speak softly now, it ain't going to work.
Harry?
We try to teach people how to talk to us. And one of the things we tell people, when you talk to me, you have to face me. I have to be able to see your lips moving. If I don't see that, we lost contact. Don't try to communicate to me when you're in another room, because it's not gonna communicate. It's not gonna connect with me. Things like that. And when you come up to me to talk to me, approach me straight on. Because of my vision. Approach me straight on, but then move off to the side when you're talking to me. Now, why am I saying you should do that? It's very simple, because if you're standing in front of me, you're in my space, okay? And you're intimidating me. But if you move off to my side, I'm going to follow you, and we're going to stay connected.
Good point. Good point.
Elon?
I love everything you guys say. This is amazing. A few years ago, I was invited to a support group for family members of people living with dementia here in Minneapolis, outside Minneapolis. And a daughter of a woman with Alzheimer's shared the following story. She said that she's the only one in her family who is able to communicate effectively with her approach and communication and gain her mother's cooperation better than anyone in the family. And then she shared, and then we learned that this daughter is deaf. And the mother never learned sign language. So as you guys say, the theme that I see here is we need much less words. She said it's the emotional bone, exactly what you guys said. It's what we convey that the mother picks up on, the trust, the collaboration, the partnership. So I just thought that story stuck with me, and I thought to share that with you guys.
Yeah, well, in the daughter having probably a higher sensitivity to what works and what doesn't communication-wise, when you're not the same as everyone else, you don't process everything, and that's one of the things that I've heard from you all repeatedly, is that you feel a lot of times your senses are heightened with things. And so if it's sound, if it's colors, if it's touch, all of that. And Harry, you had talked about even the touch, and one of the sad things I find is, now if someone's placed in a community, they're scared to touch. They're told not to touch in a lot of places. And to me, that's just so sad that we've gotten to a point in society where a few bad apples have taken away that compassionate touch that, we all, most of us, I shouldn't say all, because there's some people out there that don't like a hug, but most of us like a hug, or our hand held, or our back rubbed, or, whatever it is. And so many just feel that they can't do it. It's got to be wah, 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 wah. And we lose a lot of that comfort, that personal zone. Mary, and then I want to go to Mary down below. That's how you're showing up on my screen anyways. Oh, you got to take yourself off mute.
I think that the key is asking the person with dementia what his or her preferences are. I can't emphasize that enough, because even people with aphasia or who have gone nonverbal can still manifest their preferences, not just through technology and devices that are helpful for using letters and words and yes, no, and images and things. But you know that in a lot of managed care facilities, people are sometimes getting very angry or very frustrated or destroying things, breaking things. Those are actually communication devices. That's people manifesting their preferences. And what a lot of the staff call behaviors are actually efforts at communicating. And it gets to the point where all they have is a ceramic coffee mug, then that's going to get smashed against a wall, because that's the only way they're able to communicate. So if questions or offerings can be made to people with dementia by care partners or loved ones or staff, in simple alternatives, in trying things out in a lot of different ways, and then noting it and making sure that the next person in the staff rotation also knows it, then this type of communication between people clears things up quite a bit. And you'll note that when people have their personal preferences met, they feel much more satisfied in their environment, and it makes life worth living again.
Yeah. Great points. And I think, one of the biggest things that hits me there, Mary, is, what you're talking about is what we all do and what we all need in all of life, and it brings us back to looking at our similarities instead of our differences. So one of the things that I teach when I go out and do keynotes is an equation that really firms up what you say. And that is basically it's our attitudes plus our past experiences create our perceptions, and our perceptions of the world trigger our reactions. And when we don't like a reaction, we call it a behavior, but really it's a reaction to what we know and what we think is happening around us. And it is truly a way of a form of communication. But instead of, looking deeper at what caused that, we just say it's bad and we want to stop it. Well, if we figure out what triggered it, then a lot of times we can change what we're doing so it doesn't happen, because the other person may not be able to communicate that. And again, I think it's just an equation that goes for pretty much anybody anywhere in life, at any stage. But we try to make this a good or bad or right or wrong, thing about life. I'm going to go down to Mary Reed, and then I'll go up to Bob. Okay? Is that, Mary, I want to hear, I know you have some thoughts on this topic as well.
Well, I've lost some friends because of being diagnosed with Alzheimer's. They say that they don't know what to say to me, so they don't know how to talk to me. So I tell them, well, I'm still the same person. I'm still Mary. Just talk to me like you normally would. And yet I have some other people who tell me, you can't do this, you can't do that. I know what I can do and what I can't do. I'm an Alzheimer's ambassador to Congressman Smucker. So I go to the forums each year, and now I have a friend who says, oh, that's too much for you because it's going to be in a loud, large environment. Well, there's certain areas that you can go to. There's like a quiet room you can do. So I know what I can do. I tell people, just let me do what I can while I can.
Well, and part of it is, there's a difference between going to a concert or a fair or something that you're going to because you have purpose and you're going to maybe be doing a speech, and people forget about that piece that fills us, and you know, I've seen that over and over where people say, well, you know, I'm really kind of an introvert, but then all of a sudden they've become this advocate because there's a passion, there's a connection, there's a healing, there's a purpose, and it's all changed. And just because you don't like to be in big crowds, or you've heard that we shouldn't be in big crowds, doesn't necessarily mean it's a bad thing. Or maybe it is something that you do need a quiet room, but you're aware of that, but you still want to participate because, like the other Mary said, it's your preference, it's your choice. And I think too often we try to control those things. We sometimes overprotect. And, you know, I think when if we all took the risks out of our own lives, you know, would we really want to live them? You know, life is about some risks. I'm going to go to Bob and then Elon and then Michael. So Bob, you had a comment?
I'd like to share an experience I just had last night. Having the dementia or Alzheimer's, I communicate with a lot of people who are living here or sometimes more advanced than I am. And there's one particular person that he considered me his friend and I consider him my friend. And I was sitting next to, I usually after dinner, I'll go spend an hour with him a couple times a week just to communicate with him. He was sitting very depressed and he was feeling sad that his son wasn't communicating with him. And I kept talking to him, and then he started talking about this little girl who used to come and see him every day. And she loved him, and she'd call him Daryl. And the mother would say, where are you going? I'm going to see Daryl. And she'd come into my house, open the door, and she would just independently go to the refrigerator, find out what she needed, got her ice cream. He started talking, his whole face changed because he loved that child, right? And that child loved him. And he said, I'd take her to stores and we'd buy things. She was only 5. And so just by talking about that, his whole demeanor changed. The other thing I wanted to say about touch and all that and hugging, where I live, I can hug and I can touch because I'm not bound by any laws, right? So I do a lot of hugging, I do a lot of touching, I do a lot of talking, you know, and I have a lot of friends here. Never dreamed I would have that many friends. So it has a lot to do with who you are and that you do have dementia. It's very hard, like I said before, it's very hard to learn how to do it unless you had been stigmatized in some way.
Good points. Thank you, Bob. When I was talking about touch and community, I was referring more so to staff.
That's right. I know that. But this is why I was saying we're free. Yep.
Yeah. Great. Elon and then Michael.
Well, maybe Michael will go first, and then I'll go. That'll be okay.
Okay. Michael.
I can relate to what Mary was saying. I have to tell you, I'm connected with a lot of high-level people who are in the dementia arena, and these are supposed to be very well-educated people, and they're always trying to look out for me. And they're always trying to tell me to not do the things that I want to do because they think it's overwhelming. And it is overwhelming. I mean, I just came back from an affair that I spent 3 days at a summit. And I got to tell you, I was just so overwhelmed at it. But I try to fight through it and to be engaged, even though I know it's just so overwhelming for me. And these people are always like, tell me, Mike, well, why don't you leave? Go out of here. Instead of encouraging me to be there and fight longer, they're always trying to look out for me to tell me to get out of there and to, you know, relax and to do these things. But what they don't understand is if I was to do that and every time I feel a little overwhelmed and I keep giving up, I'm going to be giving up quicker and quicker and quicker, and I'm just going to spiral down. So I think they think they're meaning good for me to do these things, but in reality, I think if I was to do that, I would just spiral down just like everybody else. And I believe that I have to keep fighting hard to be a part of this. You know, like Mary said, you know, we go to these environments and they're very noisy. I mean, I know what she's talking about. In fact, next year I'm going to be in that same environment again, but I already made the decision I'm not going to that event. Or if I am, I'm going to be outside the door listening in because it is too noisy. And last year I did it with earplugs, but it was still overwhelming. But I still want to be a part of it somehow. So I have to find new mechanisms and new ways to still be a part of it, but not be directly where that noise is at. So
This is where accommodations come in, Michael.
you know, so the bottom line is I have to figure out how to adapt to these things. And don't shut me out because I can't be in it. Let me figure out another alternative, you know, and, you know, because what people don't realize is the minute you stop doing these things and you keep giving up new things that you want to be a part of, I'm telling you, the writing's on the wall at that point. And you might as well just say to hell with life.
Yeah, right.
Yeah.
I agree.
Well, and that's a really good point. And I see where people are, you know, trying to be respectful, because I've done the same thing too. You want to, if you're recognizing someone's stress, you want to acknowledge that. But I think to me, what comes into play then is to have the conversation with them and say, you know, I appreciate you recognizing that, but you need to understand I need to be here for me. And I need to push through, because if I start giving up, I'm going to continue. You know, I'm afraid to go down that road. The other thing, Mary, you had talked about accommodations, and how nice would it be for those big conferences to have a smaller, quieter room where the program is beamed in and you could watch it, but in a smaller environment and still partake.
That's a great idea.
That's a fantastic idea.
But you know,
yeah,
and it's a very simple thing to be able to do, because most of them are you know, are videotaped for things like that, and just do a live stream into another room that's quieter. And again, it would cost a little more money for an additional room and for the equipment, but it would meet the needs. And one of the things that I hear from you guys over and over again is a lot of times these events are not accommodating those with dementia, and yet that's who it's about. Elon, before I go to you, I want to go to Harry, because Harry, you had your hand up.
Definitely, yeah. Sure.
I get very upset about dementia conventions because they're not for us. Now, where do we go? We being us living with this dementia. Where do we go to communicate with others? It's not conventions. It's memory cafes. Okay. Now, people have all different concepts of what a memory cafe is. And a lot of people think they're support groups. Well, if you ever been to one of our memory cafes, you will know it's not anything like a support group. We're there to talk to each other without judgment, where you're free to say whatever we want to say and things like that. That's why I think it's most important that we get memory cafes in every city, in every town, in every corner, on every day, so we can have a place to go and communicate. I'm starting up a couple more memory cafes in local nursing facilities that are designed just for the residents. Now, it's not that we don't want any outsiders to come in, but I want the residents of the care facility to be able to walk to our memory cafe and know where it's at. I want them to come and be able to laugh about living with dementia. Is not all doom and gloom, and it's not all being educated. Sometimes you just have to sit down, put your feet up, kick back, and just enjoy life. And that's what I think memory cafes are a way of communicating and enjoying life.
You know, I'm going to add on to the definition of support, because I think that the support group, people think that it's structured, it's a have-do, it's something that they have to do, where it's going to be more programmatic and it's going to be more dictated. And yet I look at the memory cafes of probably being one of the most supportive from what I hear members say. But it's because of the camaraderie, it's because of the openness, it's because of the honest, authentic conversations, and going to kind of the point you guys are all talking about today, going where the people with dementia and those caring for them need to go, instead of making projections of where what we think they need. Harry, I think you had a comment, and then Bob.
We do a lot of video chats, and I do one on Friday night. And we had a newcomer come on, and after the one Friday night chat, he said, "Harry, can I talk to you?" Sure. And he said he felt he lost his voice. Nobody listened to him. Nobody wants to hear what he has to say. He says, but coming to our chat, he says, you gave me back my voice. Now, when I said thank you, I had a tear coming down, because I knew we did something good.
Yep. And that's really important. Bob, and then Mary.
Yeah, what we have going here now is a support group. And there's now 10 of us that are active in our support group. And how it's set up is that we have 10 minutes each just to talk. There is no interference. There's nobody telling you what to do. You just vent and go on. And after that's over, we try to pick one of those topics and try to see how we can help each other in the process. This same support group now, just recently, we were able to give a presentation to an audience about our stories. It was very well received, and the result of that is the 9 of us, or the 6 of us, who became really close friends, even more than the support group, because now we had a purpose together, and we supported each other in presenting. It's just amazing, the experience that we had there.
Wonderful, wonderful. Mary, did you have a comment, and then Ellen?
Yeah, well, just very briefly, it's in the process of changing and evolving with the disease that caused dementia. Some of us manifested in different ways, but in whatever ways that we end up manifesting it, we change in our relationships to other people, because we're trying to still pass as healthy in lots of ways. So it's very stressful, and there's a strain when you try and accomplish the things that you still want to accomplish that make your life fulfilling, that make you happy. And you still want the encouragement and the support to do that. But it takes a lot out of us. It's very demanding. And we would rather do that, as Michael said, than just disappear and become invisible. And so if our care partners or our neighbors or whomever could just simply ask us what we want, how we want to be supported in order to do what makes us happy, if it's not bothering anybody else, then maybe that type of a question, instead of just taking something out of our hand that we're struggling with, would be better. I was on a 20-foot ladder yesterday, sanding and hammering and caulking the window of my house. And I was scared, but I also had a lot of fun doing it, and I took a lot of satisfaction from doing it. And for months, people have been telling me not to do this and don't borrow a ladder and don't do it. But if it's what I want to do, it's my choice. So find ways of getting me the support and teaching me how to use the ladder so that I can still do it. And that's just my message.
Great. And that's a very good one. Thank you. Elon?
So I have a few things. I'm going to be brief on each one of them. You just touched upon so many important things. Mary Reed, you mentioned that friends distant themselves or left after they learned you have a diagnosis. And I remember Dr. Richard Taylor, the late Dr. Richard Taylor, said that he experienced the same thing, and it can be devastating and heartbreaking. And he said, just say hello. Just say hello. Just approach me and say hello. It's that simple. And just try to connect with me with all the beautiful techniques that you just described in the last hour, to connect with me on an emotional level. And I want to just mention Richard Taylor's amazing DVD, Live Outside the Stigma. Very, very powerful. Those of you who didn't have a chance to watch it, it's really, really good. Different way. I wish you can hand these and all the memory, I don't like this name, the memory centers across the country, once the person is diagnosed, to hand them one of those DVDs so they will have realistic hope and to live outside the stigma, really. And I think that he left us such a legacy that I think it's just a precious resource. What he has done. And the other thing I want to mention is touch in long-term care homes. You know, a lot of people with dementia have an enhanced need for social relationships and close relationships and trusting relationships, but we're depriving them of touch, and often it's just during bathing or, assisting them using the toilet, etc. in advanced stages when they're craving that touch. So gentle, compassionate touch is critical. That being said, we know also that there are people who don't want to be touched. And we need to respect that and know that. And because you will get a reaction. Speaking about reactions, some terms that we like is behavioral expressions or expressive behaviors or reactive behaviors or responsive behaviors. But even Dr. Ellen Power is now saying that he no longer wants to use the term behaviors at all. And he explains, because when was the last time we heard the word behaviors in a positive connotation?
Yeah,
right?
Very true.
These are, when you look closely, and I've done it for over 2,000 hours and hundreds of studies that I read over the years, trust me, these are unmet human needs and situational frustrations, for the most part, that intersect with cognitive disability to generate these behavioral expressions. And unfortunately, there's very powerful forces out there who are trying to tell a different story, because that can serve the purpose of pharmaceutical companies that push the medications for behaviors, etc. And I've been recently in a conversation with a group in Alzheimer's Association in Canada. I won't mention which province, but there was a psychiatrist on the phone call, on the conference call, and he's considered a leading expert, publishes on right and left, and he still doesn't believe that we're talking about unmet human needs and situational frustration. So there's a long way to go. I thought that we're reaching a consensus, but we're so far, there's such a long way to go. And the last thing I want to mention is the validation method by Naomi Feil. You, Lori, interviewed her on one of your shows. Mm-hmm. And, you need sometimes an intuition of a child to come up with an approach that works. And when she was growing up in a nursing home where her father was I believe, the administrator, and her mother was a psychologist, or vice versa, over 50 years ago in Cleveland, Ohio. And she came up with a validation method. And it really brings together in a structured way a lot of the things that you shared today. about the emotional connection, understanding the individualized preferences, understanding the history of the person, and connecting them, and understanding that behaviors are actually a form of communication of unmet human needs, with dozens of I don't like the word case studies, because people with dementia are not cases, but with a lot of illustrations that you can really understand the technique. And there's several books and films about the method, and this one is the 3rd edition of the Validation Breakthrough. And there's also a book for family members as well. So I highly recommend looking into those approaches, because it really brings together the thing that you said today, connecting on a personal, emotional level with the person first. Just wanted to share those things.
Great. Well, what a good conversation. I'm just going to toss it around one last time to see if anybody has anything to add. Bob, anything you want to add to wrap up?
I think what's important is to give opportunity for people who are stigmatized to spend time with each other and learn and listen from each other and support each other. I think that's very, very important.
Yeah. Agree. That's one of the things I love with the memory cafes, with the dementia mentors, and a lot of other groups like that. And, Harry's group on Facebook, Forget Me Nots. There's so many resources, but so few people know about them, and that's the sad part. And that's where we have to get better at disseminating that. Michael, how about you? Any last words?
I just think it's great that we have these conversations, and we discuss problems and issues, and you brought out something that was so simple that I never thought about, and probably nobody ever thought about, and that was the simple thing of just having the video conference of the conference in one of these quiet rooms. And I can tell you, I'm going to make sure the Alzheimer's Association will have that this year, and that's because of you.
Well, good. Go get them. Harry, how about you? Any last thoughts?
No, just when you communicate with us, don't forget you can laugh. Don't be serious. You can laugh. We're allowed to laugh too.
Yeah. That's a really good point. But people, I think that's one of those things where people pull away because they don't feel, they get so serious when there's illness, and they don't feel like they can do that. And that's one of, I think, the things that everybody wants and everybody misses. I mean, that's one of those emotional connective pieces that changes our chemistry in our body and the whole 9 yards. And it's just, it's a healthy thing to do, not laughing at somebody, but laughing with somebody. Mary, how about you? Any comments?
The last one would be, it's part of our human rights to be able to have our voices heard, to communicate in whatever way we have to communicate. And we deserve and we have the right to any accommodations that are needed that will help us communicate better with the outside world. It's our right. It's our privilege to be able to speak, and that's nice, but some of us will not have a physical voice after a while. And so the world needs to understand that we still have the right to communicate.
Great, thank you. And Mary Reed, how about you?
Well, like Bob was saying about a place where we have a place to talk to and get together, and like Harry says about having more memory cafes, that would be great. My memory cafe, I started because when I was diagnosed, there was no place to go to and nobody to talk to. And we have a ball at my memory cafe. We laugh, we talk, we share things. And people thank me and they say, we're like family.
Mm. Yes. So true, so true.
Yeah. Which is really important, because a lot of times people feel like their family kind of falls to the wayside with this disease. We hear that from many, many people, not everyone. Well, again, great conversation. I guess, in wrapping up, I would, just highly recommend people share this video with others, with family, with staff, with whoever. I think there's so many different nuggets in here. The ones that really came to mind is to, listen more, watch more, read those nonverbals, ask questions, get educated, don't make assumptions. Ask what a person wants in their life. It is their life. And just because, this is the choice we would make doesn't mean that's the choice a person with dementia would make. They're no different than anybody else in your life. We all make different choices. We all have different wants and needs. And that needs to continue to be respected and upheld. And I think by having these conversations like we do with Dementia Chats will help many understand that. So thank you again all for your time. Really appreciate it.